Now, education overview for artificial intelligence, AI. So AI is replacing conventional, labor-intensive and time-consuming processes in healthcare with rapid, remotely accessible and real-time solutions for diagnosis, treatment, and disease prevention. Software platforms, application programming interfaces, APIs, and digital products are being developed to extend the benefits of AI. And some of the applications of AI in healthcare include advanced surgery assistance, clinical workflow management, and medical diagnostics. So now we are going to look at the impact of AI on these 6 different categories. So the first one, consumer devices. Number 2, how can AI reduce costs? Number 3, the impact of AI in diagnostics. 4, healthcare bots. 5, treatment advancement. And 6, virtual health assistants. Okay, I'm just going to go through the first one first, which is consumer devices. Now, Apple Watches can check your heart rate. They can perform an electrocardiogram test and check for atrial fibrillation, which is a heart condition that causes irregular heart rates. Cheap and simple sensors attached to watches and smartphones, and later even smart glasses, will be able to sample our sweat and blood glucose levels. Our breath will be sampled and digitized and can be used to detect cancer or potential health problems. Our phone cameras will scan for skin cancers, and their microphones will capture data about our voices to assess our mood or even provide diagnosis of conditions such as Parkinson's disease or schizophrenia. So with more of these devices, patients can take on some of the responsibility for their own healthcare. The second one, cost reduction. AI has the potential to improve health outcomes by 30 to 40% and reduce the cost of treatment by as much as 50%. Improvements in precision and efficiency means fewer human errors, leading to a decrease in doctor visits. And doctors are also able to get information from the data for patients who are at risk of certain diseases so that they can prevent hospital readmissions. On a much larger scale, according to Healthcare IT News, AI applications can save us billions of dollars. So to give an estimate on what these potential cost savings are, AI can save us up to $40 billion in robotic-assisted surgery, $20 billion in virtual nursing assistance, $17 billion in fraud detection, $14 billion in connected machines, $3 billion in automated image diagnosis, and $2 billion in cybersecurity. And the third one, diagnostics. Very often we see newspapers reporting that machines have proved themselves more capable at diagnosing a disease better than doctors and radiologists. So naturally, this has led to speculation about machines taking over the jobs of human medical staff, especially radiologists. So back in 2016, Geoff Hinton, if you're interested to learn more about him, he's known as the father of deep learning. His name is Geoff Hinton, Geoff, Hinton, Hinton. And he did say that people should stop training radiologists now, because he believes that within 5 years, deep learning is going to do better than radiologists. So that's just something to think about. Number 4, healthcare bots. Now, bots for healthcare exist mainly for patient engagement. So healthcare bots are found in your mobile messaging apps, and they can help patients quickly and in real time by sending messages. Health chatbots can answer health-related questions. They can help patients manage medications by providing information on types of medicines and recommended doses. So some advances made in healthcare bots include the ability to learn and mimic human conversations, to detect emotions so that they can communicate with patients with more compassion and empathy, and to also incorporate natural language processing, sentiment analysis, and concept mining into chat scripts. Number 5, treatment advancement. Now, AI is leading to advancements in healthcare treatment, such as improving the organization of treatment plans and analyzing data to provide better treatment plans and monitoring of treatments. So AI can quickly and more accurately identify signs of disease in medical images also, such as MRI, CT scans, ultrasounds, and X-rays, and allows for faster diagnostics. This greatly reduces the time patients wait for a diagnosis from weeks to just a few hours and accelerates the treatment plan. And lastly, for this AI section, we have virtual health assistants, VHAs. So VHAs can help patients in many ways. For example, VHAs can help patients with dementia stay on track with their prescribed medications by sending reminders. And moreover, virtual health assistants can also give advice on treatments for common medical conditions, or even provide recipes for patients with specific diet restrictions. They can also monitor patients based on data, allow doctors to engage with patients in pharmacies to remind patients of prescription refills, pickups, and even recommend preventive health screenings. Now, say you are really interested in AI, you want to know more about the impact of AI in the field of healthcare. So these are some recommendations. We have AI for everyone, as well as AI for medicine specialization, both offered by deeplearning.ai on Coursera. AI Foundations for Everyone specialization, offered by IBM on Coursera. AI in Healthcare Specialization, Stanford on Coursera. And Learn with Google AI, offered by Google Education. Additional learning materials. This is a very interesting one. Elon Musk on AI. Causability and Explainability of Artificial Intelligence in Medicine by Wiley. Demystifying AI in Pharmacy, Oxford Academic. Transforming Healthcare with AI, the Impact on the Workforce and Organizations, McKinsey and Company. And What is Artificial Intelligence Exactly, by Cold Fusion. Okay, we have come to the end of the section for AI, and so we are going to have a poll because I want to hear from you. So I'm going to launch the poll now. So I want to hear what you think. Has your interest on AI for innovation increased? And do you think AI will take over the world? Okay, I am just going to end the poll now, and I'll just share the results with everyone. So yes, very happy to know that your interest in AI for innovation has increased. And this is really interesting. It's quite close, actually. So 55% of you believe that yes, AI will take over the world, and 45% of you say no. Thank you for participating in the poll.